For decades, beating cancer meant one brutal strategy: carpet bomb the entire body with chemotherapy and hope the cancer dies before you do. Hair loss, extreme nausea, weeks of feeling like your body turned against you. That was the price of survival. At the 2026 ASCO conference, the world's biggest cancer research meeting, researchers said something that stopped the room entirely. The antibody-drug conjugate era in cancer treatment has arrived. I'm Dr. Prasad Kaspekar, surgical oncologist, Mumbai. Today, I'm breaking down the 2026 cancer revolution in language that actually makes sense. What is an ADC or an antibody-drug conjugate? Let me explain it in the simplest way I know. Imagine a guided missile. Old chemotherapy was carpet bombing. It did not know the difference between a cancer cell and a healthy cell. It attacked everything in its path. An antibody-drug conjugate has three parts: a monoclonal antibody, a homing device that recognizes only the cancer cells, a toxic payload, the actual cancer-killing chemical, and a linker connecting the two. The antibody travels through your blood, finds the cancer cell, locks on, and only then it releases its payload inside the tumor. Healthy cells nearby are untouched, just like your BrahMos missile. At ASCO 2026, two major trials changed how we treat breast cancer: ASCENT-04 and the TROPION-Breast02. A TROP2 directed ADC combined with immunotherapy showed strong survival benefits in one of the hardest cancers to treat: metastatic triple-negative breast cancer. In lung cancer, a similar ADC combined with immunotherapy showed a 65% reduction in the risk of disease progression or death compared to immunotherapy alone. These aren't small improvements. This is a fundamental shift, and because the targeting is precise, patients report far less of the brutal side effects of traditional chemo. So is chemotherapy actually going away? I want to be honest. The headlines exaggerate. Chemotherapy is not disappearing. Not this year, not next year. But what's actually happening is combination therapy. ADCs are increasingly being used with immunotherapy and sometimes alongside reduced chemo, not as a complete replacement. For some specific biomarkers, ADCs are becoming the first line option. For others, chemo still plays a role, often in combination. Cancer treatment in 2026 is not about choosing one weapon. It is about combining the smartest weapons for your specific tumor. So is chemotherapy dying in 2026? Not entirely, but the era of carpet bombing the body as our only option, that era is ending. We are not throwing more bombs anymore. We are sending guided missiles. If you or someone you love is navigating a cancer diagnosis, ask your oncologist about biomarker testing. It is the first step to knowing if targeted therapy is the right thing for you. I am Dr. Prasad Kaspekar. Subscribe for more honest, evidence-based breakdowns of where cancer treatment is really heading.